Good morning and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing viewer-submitted questions, the latest headlines, and all news through today, April 3rd. We welcome any questions or comments down below or at any of our social media, including Dr. Murphy's new Substack, where you can see the sources to these stories in your mailbox directly. Starting with those submitted questions. First, it has been close to 6 months since this person got their last COVID vaccine. Their plan is to go ahead and get the current vaccine available and hopefully get the updated one when that comes out. Is this currently the best approach for someone over the age of 65?
Yeah, that is. That's exactly what they should do. We know that the response to the vaccine and even to prior infection begins to go down after several months. So particularly these high-risk people over 65, they should follow up with another vaccine. And then in the fall, just like this person is trying to do or says they're going to do, get the new vaccine. So they'd be taking the same vaccine that they took in September or October. They should take it now, 6 months later.
And that
Anybody
perfectly
at
fits
super
into
high
the next
risk.
question.
Mhm.
Yes, absolutely. And that perfectly flows into the next question, which is when will those new formulations of the vaccine be available?
In typically September and October.
Very good to know, and we look forward to that. Our third question today is more on the theoretical side and very interesting. This person asks, could mass vaccination during a pandemic with a leaky vaccine put immune pressure on a virus to cause endless variants? First, can you give us a little explanation on what a leaky vaccine would look like, and then answer the question?
Well, I'm not really quite sure what they mean, but this virus, no matter what is going on, will continue to evolve. It'll evolve because it will infect patients and their immune systems will push it to change in one way or the other. If you take a vaccine, it'll inhibit some of the strains of the virus better. It doesn't make any difference though, because it's all going to be happening no matter what.
Mhm. So that could be part of the factor why there are mutations, but not the only reason.
Not the only thing, though. There's a lot of things
Okay.
that influence that, and the number one thing is how much of it is replicating.
Very interesting. Now, we do have some very interesting research as well this week. Very good news for people who took the high-dose flu vaccine for older adults. Apparently, it has been tied to a lower risk of Alzheimer's. Can you break down the data for us?
Yeah, this is some very fascinating data. Very large observational study published in the journal called Neurology, which is highly well respected by some UT Health Houston group in Texas there. They analyzed data from 165,000 older adults and found that the high-dose flu vaccine reduced the risk of Alzheimer's disease in adults 65 and older by nearly 55% in the following 2-year period. And this is compared to those who received the standard dose vaccine. So the high dose is 4 times higher. So it's really a lot. And that's because older people don't make as much antibody as a younger, healthier person, age-wise. So the leading hypothesis here is that the stronger immune stimulation from the high dose vaccine dampens the systemic inflammation that is thought to drive neuroinflammation in the brain and neurodegeneration with a protective effect. It's also they found that it was more effective in women than in men, but both benefited. And the findings also added to a big growing body of evidence that linked the vaccines to reduced dementia risk, including prior research from the same team that showed the standard flu dose vaccine was associated with a 40% reduced Alzheimer's risk. And the CDC currently recommends the high-dose vaccine for people 65 and older. So just yet another benefit with these vaccines for these viral infections that can cause neuroinflammation.
And in the same vein, the shingles vaccine also was seeing some unexpected but positive benefits. Can you tell us those as well?
Yeah, so this is a University of California study that looked at electronic medical records from nearly 247,000 adults aged 50 and older who had some kind of atherosclerotic heart disease. And they compared this to those who received at least one dose of a shingles vaccine, either Shingrix or Zostavax. That was the earlier one. We don't even have that anymore. And they found a 46% lower risk of major cardiac events, 66% lower risk of death from any cause. I mean, this is really, frankly, pretty amazing. And further, the single dose reduced risk of a heart attack by 32%, stroke by 25%, and heart failure by 25%. I mean, these are really very large decreases. This is a really very large effect. Um, Prior research also has suggested that the shingles can promote blood clot formation around the brain and the heart, and that the vaccination prevents this cascade. Um, the CDC currently recommends the shingle vaccines for all adults 50 and older, as well as younger adults if they have a weakened immune system.
Mhm. Very, very surprising and good news there. Thank you for
Yeah, a
bringing us
very,
that
very
information.
large effect.
Yeah, comparable, they say, to if someone were to stop smoking. That could be the same health effect. So it is a
Right.
huge, huge effect on the body.
Huge, huge effect.
Now we'll transition into something we've been talking about a lot. Checking back in on the measles outbreaks here in the United States. Dr. Murphy, can you bring us the latest case numbers?
Yeah, we're up 96 from last week for a total of 1,671 cases, mostly unvaccinated. Um, there have been 91 hospitalizations reported in this group. So these people can be sick enough to end up in the hospital. 3 deaths still is all we've seen. In the past week, we've seen across the country 23 new cases in Texas, and reports in Florida range from somewhere between 128 and 140. And there was an unfortunate experience at O'Hare Airport in Chicago where a traveler that was coming through Terminal 5, that's primarily the international travel, was confirmed to be infected. Remember, this is a highly infectious disease. A little bit of good news here is that South Carolina, for the second week in a row, didn't have any new cases. So the the public health efforts that they're taking there are working.
Absolutely. And that was the outbreak that reached almost 1,000 measles cases. So, really, really great news that they've seen no transmission in that past 2 weeks.
Mhm.
Our final story for today is over the pond in Europe, but they have announced they have an H9N2 human avian flu case. Can you break down what this means and what happened to the traveler?
So this is Europe's first human case of this type of avian flu, which is considered low pathogenicity. The patient is up in the north of Italy in the Lombardy region, near Milan. The patient was hospitalized, was described as being in poor health prior to getting infected. We don't know the outcome yet. It remains unclear if even the person was an Italian traveler who'd been out of the country or a foreign visitor, as the person had been in a non-European country. So, people could have typically you get it from being exposed to some kind of birds or anything, but we don't know. We really don't know the story here, but they're watching it very closely. Uh, most H9N2 cases have been detected in China, with additional cases also reported in Cambodia, Vietnam, India, and parts of Africa. So it's just going to be watched closely, and we've got to get more information on that if the person was exposed to any live birds.
Absolutely. And on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise this morning, answering our viewer submitted questions and bringing us the latest data. Thank you.
Well, thank you.
And thank you all for joining us for this week's Ask Dr. Murphy, This Week in Public Health. We hope to see you back next week or at any of our social media linked down below. Have a great holiday weekend.
Have a great holiday.